I'm so excited to talk today about this recent FDA decision and what it means about women's hormonal health. I'm Dr. Trevor Cates, and I want to share what this means for us as women, and also some simple tools to help you really understand your hormones, your symptoms, and what that all can do for you. I really think that this is a pivotal moment. And I also don't want us to take too much meaning from this. I want us to be really still mindful of hormone replacement therapy, our hormones, and what all this means for us. I really just want to dive in to talking about what we have today. Um, I just have to start with a disclaimer that this is information for educational purposes. It's not meant to diagnose or treat you or create a doctor-patient relationship if you're not already a patient. And certainly, if you'd like to be a patient, I am taking patients. I'll accepting patients right now, and I'll explain later how you can get more information about that. But today, what I want to talk about is to really understand the new FDA decision, clear up any confusion and misunderstanding, and make sense of your symptoms. Learn simple tools for hormonal balance and know what questions to ask your healthcare provider, how to really talk to your healthcare provider about all of this. And so I'm passionate about this because I'm a naturopathic physician. I'm licensed in Utah. I used to be licensed in California, but I was the first woman licensed there. And for 25 years, I have been helping women with their health. I have been helping with hormonal issues and helping women understand how their hormones work, what they can do with their diet, their lifestyle, with supplements, and bioidentical hormones. And I'll talk in a bit about what bioidentical hormones are, what the difference is. And also, I've written a couple of books. I wrote a book, Clean Skin from Within, which is about how your skin is an outer reflection of your overall health. And the biggest question I got asked about when I wrote that book was about hormones. And so that's what led me to write my second book, Natural Beauty Reset. And so this is a 7-day program to harmonize hormones and restore radiance. And so I wanted to write this book to talk about all these years of doing women's health, of working with hormones. And I also did a documentary series, Hormones, Health, and Harmony, and interviewed a lot of experts on that. So I really love talking about hormones. I think they're fascinating. And then also, of course, as a woman myself, I've gone through a lot of different hormonal shifts as well. I'm 52 years old, and so I understand all the different phases. When I graduated from naturopathic medical school in 2000, I was still in my 20s, and was helping women through menopause at that time. And I know that they looked at me and thought, what the heck do you know about menopause? And it was certainly more from a perspective of from the science and from medicine and being in medical school and clinical practice. And now I have the personal experience of going through it as well. And I've certainly experienced a lot of the hormonal issues that women have, from hormonal acne and fertility struggles to perimenopause, menopause, postmenopause. Going through all of that also gives me a new layer of respect and understanding of our hormones. And so that's why I love talking about it. So, what are hormones? And so, hormones are chemical messengers that impact really almost every system of the body. And that's why I love them so much, because they play a role in all the different aspects of our body. And it can impact our mood, our metabolism, our sleep, our skin, our cycles when we're still having them, and energy. And they work best when they're in balance and communicating with each other. They are these chemical messengers, so they are playing with each other. And they chemical messengers communicate with each other. There's not, when we talk about hormones, a lot of times people think about estrogen, progesterone, testosterone. And those are sex hormones, and those definitely are important. We'll be focusing on those today. But remember, there are stress hormones like cortisol. And cortisol is really important because when our adrenal hormone cortisol is too high on an ongoing basis, it suppresses our sex hormones. So even if you're on hormone replacement therapy, if your stress level is really high and your cortisol is really high, then it could suppress your hormones and make it more challenging to get the effects of hormone replacement therapy. And even if you're not on hormone replacement therapy at this point, you may also notice issues with your stress hormones impacting your cycles, impacting a lot of different aspects with your sex hormones. And then also there are our sleep hormones like melatonin. And of course, our sleep then impacts the other hormones. And melatonin isn't just for sleep, it's also a potent antioxidant. And then there are neurotransmitters like dopamine and serotonin. And serotonin is also a hormone. These are interconnected. They impact each other. And our metabolic hormones like thyroid. And so a lot of women develop issues with thyroid hormones. It's a common thing for women to develop hypothyroidism or autoimmune thyroid disease. And so all of these are interconnected. So I talk a lot about hormonal harmony. If you're in my hormonal harmony Facebook group and interacting in there, or you get my emails, or you have my book, Natural Beauty Reset, I talk about hormonal harmony. So what is this? And so the reason why I like hormonal harmony is because I think of hormones as musical instruments, and your body is like a symphony. And each instrument, so each of our hormones has to play its part perfectly. So that's the right volume, rhythm, pitch, melody, and tone. And so there are all these different aspects to hormones, and they need to be balanced to create the beautiful song like a symphony. And when they're out of balance, just like an orchestra can be out of tune, it cannot sound so great and we cannot feel great. But our hormones are not the enemy. Hormones are incredible chemical messengers that play an important role in the body. We just want them to work as they're designed. So, what disrupts our hormone? So, there are a lot of things that can disrupt our hormones from medications like birth control pills. There are endocrine disrupting chemicals in our environment, in our air, water, food, and personal care products. So, these endocrine disrupting chemicals can actually bind to hormone receptors in the body, and the body thinks that it's trying to figure out what it does with everything that enters the body, whether when it comes into the bloodstream, wherever it comes from. And so it's trying to match, like, what do I do with this chemical? And so with the endocrine disrupting chemicals, they'll say, oh, this looks like a hormone, so let's bind it to our hormone receptors. And so all these various hormone receptors in the body get turned off or turned on, and it upregulates different symptoms and diseases. So if the body has, for example, an estrogen mimicking chemical, then the body thinks it has more estrogen when it actually doesn't. So endocrine disrupting chemicals, that's not the focus of today's webinar, but it really is incredibly important. And I think there's not enough attention put on this right now. We are exposed to more of these endocrine disrupting chemicals in our environment than we ever have been before. So they're the ones that are being made now. And then there are the ones from the past that continue. Maybe they've been banned, but they continue to exist in the environment. And so we're getting exposed to light. And I think that's why we're seeing a lot more. And it's not just me that thinks this is more of a common thought. is that we're seeing more girls entering puberty early. We're seeing more women experiencing fertility, couples experiencing fertility issues. We're seeing more, I think, even more problems in menopause. Some of us women being, more vocal about it, which is really great. But some of it is might be having to do with the endocrine disrupting chemicals that we're exposed to. And then there's also nutrition. And a lot of this ties into our blood sugar fluctuations because we have insulin is another hormone that is also very important. And our ups and downs in blood sugar play a role in our hormones. And so that includes how we eat as far as the types of food we eat, the timing, the quantity, and quality. And I have some tips on food in a moment, and I'll share with you. So, and then also inadequate sleep, and that is not the right timing, the duration, quality, overwhelming stress. Stress is normal. Our bodies are quite resilient. We're designed to handle certain amounts of stress. But if it's ongoing and we never manage it and we let it overcome us, we never take breaks, we don't get the right amount of sleep or rest or recovery, then it can definitely play a role. Like I mentioned, that cortisol increase can then suppress the other hormones. And then inflammation and gut imbalances, those also impact our hormones. And then, of course, transitions like pregnancy, postpartum, perimenopause, menopause, and aging itself, of course, impacts our hormones, which tend to decline as we age. And we have these different stages that we go through, of course. So I just want to make sure that everybody understands exactly what menopause means. Menopause is when it's been 1 year or more since your last period. And then once you've gone past that time period, then you're really in postmenopause. And then if you're in that time or your period, you're still getting it, or it hasn't been quite a year yet, you're in perimenopause. And then, of course, anything before that is premenopause or normal reproductive life. So what we look at with perimenopause is a lot of women don't realize, or they're starting to become more aware that perimenopause can start as early as a woman's 30s. So, I mean, this is why a lot of doctors, at least in the past, have said, oh, you should try and if you want to get pregnant, try and get pregnant by the time you're 35. And that's really because that's when we can start experiencing changes with ovulation, with the release of hormones from our ovaries. And it varies very much from one woman to another. Some women do start to experience symptoms in their 30s. Some women don't have them until well into their 40s, or maybe they don't even have any symptoms and they hit menopause in their 50s and that's it. But most of the time, women are experiencing some symptoms. They may just not realize that their symptoms are related to their hormones. And there are common symptoms, and then there are also not so common symptoms. But the common symptoms of hormonal imbalances before menopause, since this is even before perimenopause, even like just after you get your period. This women can experience, of course, period problems and breast tenderness, PMS, PMDD, which is a more severe form, PCOS, endometriosis, fibroids, hormonal acne, memory and mood concerns, and infertility. So these are all, of course, related to our hormones and are quite common in a lot of women. And then we get into perimenopause, and we might start to experience some of these symptoms: irregular periods, mood changes, insomnia, fatigue, dizziness, hot flashes, night sweats, weight gain, especially in body fat around the abdomen or loss of muscle, brain fog, cognitive changes, vaginal dryness, and GU infections, so yeast infections or urinary tract infections, decreased libido, thinning hair, dry and thinning skin, joint pain, headaches, breast tenderness, digestive issues, or worsening of existing conditions like migraines, allergies, or autoimmune disorders. And also, I would say gut issues, seeing more and more of that in women as well. So, and then we also can experience symptoms post menopause. So I think there's a lot of focus right now, particularly on perimenopause, but I don't want the women who've already gone through menopause to feel left out because there are things that hormones are still affecting you. It's not just that transitional time of perimenopause where we have symptoms, but even after your cycles stop and it's been a year, you could still be having symptoms. And you could also be at higher risk for certain health issues. So, vaginal and urinary changes, so increased dryness, discomfort, weight gain, metabolism, you could still be experiencing some of this. Our risk for diabetes goes up. Women tend to have more issues with blood sugar, increases in blood sugar, and insulin issues, insulin not working as well. Brain brain fog and memory issues, difficulty concentrating, cognitive decline. That has a lot to do with the decline of the lowering amount of estrogen, but also could be testosterone as well. Mood shifts and anxiety. So some women will experience depression, irritability, and just not as resilient feeling as they used to be. Skin, hair, and nail changes. So thinner, drier skin, brittle nails, hair thinning, joint problems. And oh, sorry, the joint was supposed to be on the next line. Joint pain and stiffness, estrogen decline worsens inflammation, and also sleep issues, insomnia, heart disease risk significantly increases after menopause. We surpass men in risk, and cardiovascular disease is the leading cause of death in women. And I don't know that women realize that we are become at higher risk when we go through menopause because, and this is all of this and the bone loss and osteoporosis, risk of fractures, all of this is because of declining hormones. Now, this can be addressed if we get support from hormone replacement therapy. And I'm going to talk about all of that in a moment. But before I do that, everyone it's all individual here. So you can start asking yourself some questions to say like how are my hormones and how am I doing right now? You could ask, how is my sleep? How has my mood or anxiety, or have I had any mood or anxiety changes? Any shifts in my energy or motivation? Am I noticing changes in my skin? Do I having cravings or my cycles changing? Are symptoms cyclical or are they constant? And that's particularly important for women in perimenopause or women that are still cycling. Do these change or are they constant? And those are really important for us to look at. So I skip this one. What do you do when something feels off? If you're starting to notice some of these changes, you really want to track your symptoms, looking for if you're still menstruating 1 to 2 cycles, tracking these symptoms and what's changing over that. It's important to get appropriate labs. And timing really matters if you're cycling. So generally with a 28-day cycle, you want to get around day 19, get your hormones tested if you're doing blood or even with like a Dutch test or urine test. And if you're already past, or if you're having irregular cycles or you're not having any cycles, you just pick a time and hopefully it's the best timing. And you can discuss these patterns and your labs with your provider. You want to consider lifestyle, nutrition, and hormone replacement therapy options. Don't ignore persistent or disruptive symptoms. And of course, you all that are here on this call or listening to the recording, you're here because you know something's not right or you know that it might be related to your hormones. But I hope you'll encourage other women too, because there's not a day that doesn't go by. Women come up to me like, is this my hormones or am I having this symptom? Is this related to my hormones or what's going on? There are so many symptoms related to our hormones, and it's it's something that we can address. So don't ignore it. And don't just feel like, oh, I'm getting older. Oh, it's just because I'm a woman. Or, oh, it's because I'm stressed. No, you need to look into it. Don't just put up with it and suffer through it. Those days are gone. We don't need to do that anymore. That's something that we used to do in the past. Let's not do that anymore. Speaking of the past, how did we? I want to lead up to the new Black Books warning and what happened with the FDA. And so, but I want to share some just kind of like how we got here. I want you to understand something. It wasn't until 1986 that the National Institute for Health, NIH, established a policy that encouraged research to include women in studies. But it was not law to include women in research until 1993. And still, there's been research showing that women are often still substantially underrepresented in clinical trials for leading diseases. So we have some catching up to do. We're behind the times to begin with. And so what's happening right now is actually quite beautiful. And when I was in medical school, we saw these kind of predictions of, how many women were going to be going through menopause at different times. And we knew this time was coming. And here we are. So 50% of the US female population now is 40 years of age or older. 55 million women in the US and approximately 1.1 billion women worldwide are postmenopausal. They're after menopause. The average woman can expect to spend 40% or more of her life in postmenopause. So there are more of us women that are going through perimenopause and menopause going, wait, something's not right. We're not getting the help we need. And I think that is a big part of what led to this, this black box warning being removed, of them looking again at the Women's Health Initiative study. And so, but part of the thing is that it's been really hard because there hasn't been the level of education in conventional medical schools that has given women the ability, I mean, given doctors the ability to understand women going through menopause. So when surveyed, 80% in this particular survey, 80% of graduating internal medicine residents do not feel competent to discuss or treat menopause. And I feel this way when I talk to a lot of doctors, conventionally trained doctors, that they just didn't get this information. And so only 20% of OBGYN residents offer menopause training, and half still felt they still needed more education on menopause medicine. 85% of perimenopause and menopause women experience a wide range of symptoms that impact the quality of their life. And despite all of these menopause symptoms and the impact on quality of life, 72% of women experience these symptoms do not receive any treatment, and 77% have not even discussed treatment options with their healthcare provider. So don't be one of these statistics. Talk to your doctors and seek out the type of doctors who are updating their training or got the training. I mean, it's really interesting. I've got so much training on hormones in naturopathic medical school and have so many tools in my tool belt, have used them for 25 years, including bioidentical hormones. I've been using it for 25 years with my patients. And so hormone replacement therapy. Let's talk about what is this to begin with. So hormone replacement therapy is used to supplement or replace hormones that the body no longer produces in sufficient quantities. This is, usually with menopause, but it also could be other hormonal imbalances, sometimes like postpartum, where our hormones completely decline, especially estrogen. That can be a time where a woman might also need it in certain forms. But generally, it's perimenopause, menopause. They come in different forms like pellets, injections, oral, transdermal patches, topical creams in both skin and vaginal applications. And there are bioidentical, or what some people call synthetic, but I think that's misleading. It's really what I would call the more conventional forms like progestin, which is in synthetic progesterone, and CEE, which is conjugated equine estrogen, so Premarin. And Premarin, I mean, if you think about it, hey, that sounds kind of natural because it comes from the urine of pregnant mares. But it's still synthetic. It's still considered synthetic. But really, all of the hormones, even bioidentical hormones, have a synthetic component to it because you're not just going out and eating a wild yam itself. So I think it's misleading to say synthetic because bioidentical has a synthetic component to it too. Okay, so Women's Health Initiative study, what was this thing and why did it create such a big problem? So the Women's Health Initiative study, and I remember this really well because I graduated medical school in 2000. So this was like hot off the press. I'm like going to conferences and hearing about this. We're still, I'm going to bioidentical hormone replacement therapy conferences, learning from Dr. Jonathan Wright and all these people who've been doing it a long time. And so this study led to widespread media coverage and public concern about the safety of hormone replacement therapy. And so unfortunately, what we now know is that this has negatively impacted women's health because it, because all these women that went off of hormone replacement therapy, we're talking over 20 years when they could have been on hormone replacement therapy and they didn't get the benefits from that. And so, what we've seen in this time as having more women with hip fractures, with osteoporosis, with cardiovascular disease, with cognitive decline, mental health issues. And so, we're seeing much more. We saw much more of this. And so, it's really been a big issue in women's health. And so the participants were given of this study were given oral hormone replacement therapy. They were on oral hormone replacement therapy, which I think is really important for us to mention because now we know we have all these different other types of hormone replacement therapy that can be safer, like a topical in some cases or a patch. So and they're also in the form of Premarin, which is that pregnant mare urine, and Prempro, which is a combination, and which is progestin. Sorry, it's not combination, it's progestin. And that is, so progestin is the synthetic, not molecularly the same as our natural made progesterone. So this came out, this press release, this news, the FDA news release hit all the media, major media, and this was just last month, November. And they said, okay, we're removing these black box warnings from hormone replacement therapy. So what has actually changed? So the FDA removed the black box warnings for heart disease, breast cancer, and dementia on estrogen-containing menopause hormone therapy. So in the packaging, the risks are just still discussed, but there's just not a black box warning. And so the decision reflects more accurate scientific evidence. They now say, okay, well, we realized that the what was going on with this study was that it was not statistically significant. The results weren't. And the one of the big things is that the women in the study were over 65. And so the reason I bring that up is a lot of hormone replacement therapy is started to help women in their 40s and 50s. But these women were starting it in the study, they were much older than what we are typically doing in clinical practice. So, the goal of all of this is really to help provide more evidence-based information for women. And I think that overall, this is a good thing. But I want to share, but there's a caveat here, some caveats. Um, so what it did not change is that estrogen alone still carries a black box warning for endometrial cancer if you still have a uterus. So what we generally like to do, what doctors generally like to do, is to do progesterone with estrogen when we do hormone replacement therapy if a woman has a uterus. Now, in my practice, I'll give progesterone to most women. Very rarely do I give estrogen only. Even if a woman has had a hysterectomy, does not have a uterus, because there are progesterone receptors all over the body, not just in the uterus. So our bodies still need some progesterone, in particular our brains. And because progesterone can have a calming effect, it can help us sleep, and it can help with hot flashes. So it's not, I think that it's still important to do these together. And so that's how I might differ from some conventional doctors. But I agree with this, that we need to be careful with estrogen alone. And so, particularly for women with a uterus because of the risk for endometrial cancer. And this is really, really, really important. Individual assessment is still essential. So we need to look at age, timing, health history, and regular follow-ups are essential. So my concern about this, I think it's great that we have this black box warning removal and that the FDA has done this to help more women to have access to it and there to remove some of the risk. But we also still need to be mindful. So the decision on this was made because earlier data overstated the risk, and now there's more newer research that shows risk varies by age and timing, and and so this fear-based messaging that came from the Women's Health Initiative study is being reduced to help women get access to hormone replacement therapy who it will benefit. And so this is overall really good news. And so updated research since that 2002 study with randomized studies show that women who initiate hormone replacement therapy within 10 years of the onset of menopause, and the average age of menopause is 50 to 52, somewhere in there, typical. So generally wanting to start it before the age of 60. If women do that, they have a reduction in all-cause mortality and fractures. All-cause mortality and fractures. So if you're a woman before the age of 60, so I want you to pay attention to this. And if you're a woman over 60, it's not that you shouldn't do hormone replacement therapy. Um, if you haven't started it yet, but we just need to look at some risk factors. That's all it means. So women may also reduce their risk of cardiovascular disease as much as 50% with hormone replacement therapy, Alzheimer's disease by 35%, and bone fracture risk by 50 to 60%. That is significant. So I know there are a lot of women out there who are saying, well, I don't really have symptoms, or my hot flashes really aren't that bad. I can manage it. Well, okay, if you don't want to do hormone replacement therapy for your symptoms, this alone is something to look at, the prevention, and not waiting until you have these diseases to start thinking, oh gosh, if only I had. So I really want this to hit home because it's one of, we've made this mistake already over these 20 some years of, and I'm saying we, like, but I've continued to give hormone replacement therapy to women. But I mean, we appreciate it. Naturopathic doctors, even and functional medicine doctors, appreciate this too because now we don't have to fight this. But it is, we learned so much overall that we're doing a disservice to women not to offer them hormone replacement therapy. So, what does this mean for you? And again, this is different for every woman. And this, what it means for you is this creates more opportunities for conversations with providers who used to just say, nope, I don't do hormone replacement therapy. It's not safe. Now, you'll probably still encounter providers that will say that are kind of old school, that still don't trust the establishment or want to do things the old-fashioned way, the Women's Health Initiative study way. But I encourage you to find the providers who are open to these conversations and that are ready to do this. And also more conversations about benefits versus risk rather than just telling you all the risks. Better access to individualized options. And I'm hopeful on this one, but I am also concerned because what I'm worried about is I'm seeing a lot of doctors now going or healthcare providers going and get trained on hormone replacement therapy. And I'm worried that they're going to try a cookie cutter approach. I've been doing this for 25 years, and every single woman that walks in my door or shows up on my screen in a virtual telecall is is different. And so I can't give the exact same protocol of hormone replacement therapy to every single woman. Now, I have ones, my go-tos, my regular, my favorites that I know work well in most women. But I tell you what, every single woman is unique. Now, of course, the type of women that oftentimes come see me are the women that have already been to see other healthcare providers and they're not happy, so they come see me, or they have so many health issues they don't know where to start. So I do send to see the more complex patients. But I am concerned, and I see people on social media saying, "Oh, all you need to do is this patch, or this pill, or or this injection, or this pellet," and I just think, oh gosh, does that person actually see patients? Because what I'm seeing is it's not a one size fits all. Not everyone can do the same hormone replacement therapy. So please keep that in mind. If you are seeing a provider that does the same thing for every patient, I'd be concerned about that. So, but also this update also means less worries about outdated fear. It's not that it's going away yet, but you should see less of it. um, Lifestyle is still important. And let's talk about that. So now that you know what this update is about and my take on it, and that, really what we need to do is yay, celebrate that black box warning has been removed. And we're acknowledging that study was the Women's Health Initiative study was flawed, and that now women can get access to hormone replacement therapy without all the fear, and doctors can feel more comfortable prescribing it. However, it's not just about hormone replacement therapy. Hormones, we need so much to support our hormones. And our hormones do naturally fluctuate and decline as we age, but we can optimize their production, especially in perimenopause. We can optimize their function and balance by addressing root causes. Now, this is a truly naturopathic approach. That's my background. So that's what you're going to hear from me is I address the root causes. And so when I do that, I'm looking at this more holistic approach. I'm looking for nutritional deficiencies, metabolic issues, because remember, it's not just sex hormones, but like thyroid hormones, other hormones can play a role. Um, Inflammation, gut disturbances, sleep issues, stress, and those endocrine disrupting chemicals, those toxin exposures. So we want to look at all of those. So food is a big part of it. So getting high fiber, a diversity of colorful produce that are rich in antioxidants, cruciferous vegetables that support hormone metabolism, and plenty of protein. So 20 to 30 grams at each meal. And those can come from healthy sources like wild Alaskan salmon, nuts and seeds, especially things like flaxseed could be good, and legumes, eggs, free range grass fed. And so getting 20 to 30 grams of that at each meal. Omega-3 rich foods that help support decreasing inflammation, support brain and hormone function. We need healthy fats for our hormones to function. We need minerals, especially magnesium. So nuts and seeds, leafy greens, legumes, even dark chocolate. Just watch the sugar intake on those because minimizing sugar and highly processed foods is also important. And I know we're going into the holidays, so just keep that in mind. Drinking lots of water, clean, purified water, hydrogen water if you prefer that, or at least very clean, maybe reverse osmosis water. Limit or avoid alcohol and caffeine because those also can interfere with our hormones. So if you want more about foods, on my website, drtrevorcates.com, there's a free download right now. So when you go on the website, you'll see something pop up, and it's my hormone balancing foods shopping list and recipe guide. So there's a food list in there, there are recipes. That's free. It's on my website. So if you don't have this already, it'll be up for a limited time. We're going to be putting up, so I have like some seasonal stuff I put up. So that will be, this will be disappearing soon. So if you want this guide, go ahead and grab that at drtrevorcates.com, a free guide, and you'll just have to put your email address in and you'll get a copy of this. So other things to think about besides food is getting some morning light, getting in a good sleep routine, making sure that you're doing stress management to help your nervous system regulation. Strength and resistance training helps with your bone health over time, and it helps with like your testosterone and reducing endocrine disrupting chemical exposures, and supportive supplements where appropriate. And I've covered supplements in past webinars. I don't have time to do that in this webinar, but you can find specific recommendations in the last chapter of my book, Natural Beauty Reset. I did notice on Amazon, I was looking at the links for Natural Beauty Reset and Clean Skin from Within. And I just noticed that there are very few copies left on Amazon. So I have notified my publisher. So if you go on and it looks like there aren't any copies on Amazon, you can go to thespadoctor.com, thespadr.com. That's the company that I founded. It's a natural skincare and supplement company that I founded. I sold the company a few years ago, but they still sell my books on the website. I know they have some in stock. And also work with a healthcare provider who can customize your needs. If you're in Utah, I'm happy to help you if that's where I'm licensed. I'm looking at maybe getting my California license again so that I can help some of my California people. But if you're outside of Utah, it's kind of tricky. But if you want to come to Utah, if you're planning on being here, that's great. So this is my book, Natural Beauty Reset. When it came out, it was #1 in multiple categories on Amazon. So I know people have questions about hormone replacement therapy as well. And I do talk about hormone replacement therapy some in my book. But again, it's very individual depending upon your symptoms, if you have them, what your goals are, as well as, I think, lab results. Now, some healthcare providers don't do labs because they said, well, if you're in perimenopause or menopause, your hormones are going to be low anyway. So what's the point? Well, there is some truth to that, but there are a lot of other things to test that you can test besides estrogen, testosterone, and progesterone. So, for example, looking at things like cortisol. Is your cortisol high? If your cortisol is high on an ongoing basis, then that could impact your hormones, and that could impact your ability to respond to hormone replacement therapy. So, and I like to do a saliva or urine test, but preferably a saliva test for cortisol because we can do it throughout the day. And it's a great way to look at cortisol. And so there's a diurnal rhythm that happens with cortisol where it should be high in the morning to get us going. And then it should get lower in the evening so that we can fall asleep. So things like that. It's important to look at labs, not just estrogen, progesterone, testosterone. And then when someone's on hormone replacement therapy, I still like to do those because I want to see how their body is responding. Lab tests are not perfect, so it's really about what I think is important. And a good clinician is going to look at both the patient, your symptoms, and the lab results, and not just one or the other. Okay, so what are bioidentical hormones? So bioidentical hormones are molecularly the same as our natural hormones, the ones that we make. So our bodies have an easier time discerning how to use them properly and how to metabolize them. So this is why they're so important. And this is why when I was in naturopathic medical school and when I came out and I did my training on bioidentical hormones, this is why it made sense for us and why when the Women's Health Initiative study came out in 2002, with synthetic, with the equine estrogens and the synthetic progestin, we were like, well, no, that's why they're having problems with that study, the women in the study, because they're not getting bioidentical hormones. And this is something that isn't pointed out quite as much with the media that's happening now. But I think a lot of practitioners are coming around to realizing that bioidentical hormones are probably safer. So, and this is why when you look at the science of it, when you look at the molecular structure of how these are made, these bioidentical hormones, and they're generally made from things like wild yam, and they are synthesized in a lab. So there's a synthetic component. These aren't completely 100% natural. 100% natural is going and picking some dirt and some twigs out of, your backyard. So anything that's synthetic is made in a lab to do something. So yeah, so they are bioidentical though, and that's why I think they work so well, and women tend to have less issues with them, and men too. Um, some men, do well with some hormones too. So I'm really talking about women here though. Estrogens include estradiol, estriol, and estrone. Those are the three main types. And what are typically prescribed are estradiol or what's called biased, which is a combination of estradiol and estriol. Very rarely, I don't think anybody really uses estrone anymore. We used to have a triest when I came out of naturopathic medical school, but most people were using biased. And so I don't think anybody uses that anymore because we found estrone is not as safe of an estrogen. So there's a lot of information out there about whether it's biased or whether estradiol. For the most part, most women do really well with estradiol, and it is the most active form of estrogen, so it's the one that's going to give the most benefit. So what I find with women is that estriol is also can be very beneficial, and especially if women are experiencing vaginal dryness or recurring urinary tract infections, especially if we use like a topical vaginal estriol. And that's something that maybe after a postpartum that women might need to help with healing the tissues after labor and delivery, and our estrogen's low and I can't heal that tissue very well. Some women benefit from that. So that's why, but most women do really well with estradiol. Progesterone is just progesterone, not progestin, but progesterone. Testosterone is bioidentical. DHEA is another one. So if you're using hormone replacement therapy, I do think it's good to get your hormone levels tested. And then I like to do the urine test because that looks at metabolites. So I know how your body is breaking down the hormones because some metabolites are riskier than others. So there are these feedback mechanisms what happen with your hormones. And so if they're not breaking down properly, and part of it's genetic predisposition, some of it's lifestyle, then we can do things to support your body, your help with your liver function, for example, different like methylation pathways or different things that can help you with metabolizing your hormones to help decrease your risk. And so without going into too much of the, nitty gritty on that, I think that's probably high level. That's probably a good place to go. So now what's right for you? It really depends. What are your symptoms? Are you having any symptoms? What about disease prevention? Do you want to prevent osteoporosis, dementia, cardiovascular disease, some of the things that we've talked about? Do you have any risk factors? Do you have a uterus or not? Do you have family history of endometriosis, of breast cancer? Have you had breast cancer yourself? But even if you have some of these risks, it's still good to talk about the pros and cons and what are the benefits, what are the risks. Now, if you are within 5 years of having breast cancer or currently under breast cancer treatment, no, hormone replacement therapy is not a good idea. But if it's been more than 5 years and you're clear, then talk to your doctor because they're now saying that it can be after 5 years of being clear of breast cancer. It might, and you're having issues and you want to protect your bones. You've got osteoporosis risk in your family. It may not be contraindicated anymore. Lifestyle, if you, that's a big part. How's your lifestyle? What are your life goals? And what is your access to healthcare providers? Because that can be a limiting factor too, depending upon which state you're in. Naturopathic doctors are licensed in a lot of states, but if you're in a state where naturopathic doctors are not licensed, then there are functional medicine doctors who might have gone through some training to understand bioidentical hormones. So you could also look for them. So I am going to stop the recording here pretty soon to answer questions and for those that are live. And if you're watching the recording, well, for those who maybe joined late or maybe want to catch this again, I am going to put this up on my YouTube channel so that you can catch the recording. And if you're interested in working directly with me, there is a QR code here. I would recommend scanning this code. This is how you can schedule a free discovery call with me, a free 15-minute call, if you are interested in becoming a patient. And if you're in Utah and you're looking for someone for maybe part of your healthcare team, or you're looking for some help with hormones, then yeah, let's talk. And if you go to my website, drtrevorcates.com, you can learn a lot more about my approach. You can also book a free discovery call from my website. There is a small fee associated with that, just because I have to screen out the people that are just trying to sell me something, which unfortunately I've had that experience. So I had to put a little fee associated with that. But if you've gotten this far in the webinar, you're probably not going to just schedule a call to sell me something. All right. Well, I thank you all so much for joining me today. I'm going to stop the recording so that I can answer all of your great questions.